Where is our DMCs, our developing member countries? What questions are they asking? Where do we want to see support, and how can we provide that? That's a big question. I think we put this on presentation mode. And is this how I do it? Yes. Digital literacy is one of the key, that's the key areas of our guidance. Anyway, let's just think of this from a broader perspective. Asia and the Pacific is growing, we know that. This year, the growth here is actually 70% of the global growth, according to IMF. So this is a region that is forward-looking. We know that investments in human capacity is the vehicle to drive economic growth and to reduce poverty. What we see more and more is an emphasis of higher level skills, and including the digital skills, of course. Many countries are struggling, needing to reconsider what is education. How can we use education more in a more practical way to actually drive economic growth? There are many challenges that do remain. The quality and relevance, we all know that. There's pressure from climate change. I work a lot in the Pacific region, and there climate change is real. We know that where we could grow tomatoes last year, we cannot grow tomatoes this year because the water is salt. So, and how can we equip young people with the skills and the knowledge to be prepared for that future? The nature of inequalities are different today than they were 10 years ago. So yes, there are a number of challenges. The learning crisis is one. We have to go back to basis in many projects. Literacy and numeracy outcomes are low, and we know that. The quality of education is not where it should be. We know that being a teacher, maybe some of us in this room have had that experience, and we know it's a lonely job. And we know that driving quality improvements in the teaching force is one of the key interventions for better learning outcomes. Slow pace in adapting curriculum, content, teaching and learning material. Soft skills is this area which often are requested, especially from employers. And there is a mismatch between the supply and the demand. So yes, we face these challenges, but many governments see that this is a priority area, and COVID-19 gave a push to reimagining education and how it can be delivered. Quickly touch upon the regions that we are active in. These can be presented in a little bit different ways, but from these charts you can see that South Asia is an important area. Bangladesh is one of the biggest countries when it comes to education projects. We see that Southeast Asia is 30%, and we will go into these pies a little bit more in depth. If we just look at the subsectors, and I think this is one important message from this session, that if you look at the TVET part of this pie chart and combine it with the secondary high school education part, you'll see that that is 60-65% and has so been in the past. So ADB, or our developing member countries, are very often coming to ADB asking for support in skills development and in high school development. We are active in primary education, in higher education, but the focus looks like this. Similar, if we just look at the current portfolio across the bank. Looking a bit ahead, there is a clear ambition from ADB to increase support in the education space. The official target is that 10% of our operations should actually be to support education improvements, with the backdrop that this is a key area for driving economic growth, creation of jobs, and reduce a commitment that will land on approximately 1.3 billion. Looking at 2024, that will increase to 2 billion. When we ask companies to support us in this, it's really in 3 phases of our project cycle, where we advertised for expression of interest, where we really need you to step up and support these developments. And the first one is in the design phase, moving from a concept to a bankable project. It's a big task, which often is funded with our transactional technical assistance. And that is really the preparation and the due diligence. When that phase is done, and hopefully this is approved by the government, by the board of directors in the bank, we move to implementation. These figures that I have shown, of course it varies from project to project, but very often there is an infrastructure component in these projects. We don't have any clear statistics, but approximately 30 to 40% are usually hard investments in classrooms, in toilets, in water supply, or what it can be. And 60 to 70% are the software inventions, where really the learning outcomes come. This is often a debate. The Ministry of Finance wants nice buildings. The Ministry of Education wants good content. So this is always a balance to strike. But during implementation, of course, project management and the technical support, plus the civil works, are important aspects. And then monitoring and evaluation at project completion. A few words about what we think we are seeing. The DMCs are asking for funding, yes, but that's not enough for many. They need to see additional value. We need to bring to the table knowledge and partnerships and other aspects that makes this partnership between ADB and the country valuable. Climate change, STEM education, EdTech solutions are very often on top of the discussion. Innovative approaches to keep up with global trends. How can we bring in best practice? How can we leapfrog are questions that our clients want to have answers to. Sharing best practices and impactful models. In order to do this, I think this design phase is just becoming more and more important. We need to do proper analytical work. A poorly designed project is always a poorly implemented project. So the design phase is becoming more important. And it will also cost more money. And we are fully aware of that. We as a bank are guided by our strategy 2030 and the 7 operating models, where now the first priority, OP1, that's where education sits. It's really about reducing poverty. It's really about creating jobs. It's really about creating livelihoods. And here the education is the vehicle. Innovation is something that must come into this space. And as I mentioned, this diagnostic work ahead of project implementation is becoming more and more important. And that very often gives the opportunity to source additional funding, because that's one of our key roles is to attract funding, sometimes private sector funding, sometimes co-financing from other donors. And that's the value add that our DMCs are expecting. What is becoming more and more important is global partnerships, which I think is something that you all should think about, that when we bring our expertise, what kind of partnership can we also bring? Many of these institutions need to have twinning arrangements. They would like to exchange on a more daily basis with practitioners in other countries. So that is definitely something that we will increasingly look at when we evaluate proposal. Where are these partnership links? Yes, and our ambition again, we working in the bank need your help to scale up this operation. We want education to grow. That's the key message. I'm not going to go into these things in detail, but as I've mentioned, we do work in the K-12 space, we work in the TVET space, and in the higher education space. And there are a number of assignments that we ask the market to support. Equity, inclusion, and equal opportunities are always cross-cutting. One space, for example, inclusion for people with disabilities, is something that we haven't done that much. We need to do more and more questions come in this space. How do you make it possible to really create learning opportunities for all? Multi-sectoral approaches, how can we bring in education into other investments? If we invest in a road, we know that skills are needed. If we invest in a hospital, we know that skills are needed. If we invest in any area, a key driver for success is knowledge, skills, and attitude. So here is an area where a lot of thinking is happening as we speak. I mentioned inequalities. Gender is a huge topic in the bank. The climate change shift is just pushing this even harder. And I think we can also see that the post-COVID actions is actually something that drives development in the education space. We also need your help in knowledge products, knowledge support. Because, of course, our bread and butter work in the bank is to finance projects. But this always comes based on knowledge work that we contribute to. So this is, again, something that we are asking the market to support. We are in the midst, I think you've heard this earlier today, we are in the midst of a new operating model. And we are talking about a number of shifts. And the climate shift is one. How do we bring in climate into all education, from early childhood to research? Of course, the digital shift and the ask for good edtech solutions that actually generate good learning outcomes. How do we link the private sector to the education space? And how do we strengthen capabilities in the bank around the opportunities, but of course within our DMCs and in partnership with you? I have 2 slides, and I hope it's possible for you to at least get a sense. If we just combine the current pipeline with the commitments that will happen this year, this is the result. So there might be special interest from some of you. I see a number of telephones, so that's good. So this is a list that kind of adds up to the 1.3 billion that we expect that our board of directors will approve this year. I am engaged in some of these activities, and of course, as we said, we want to scale this as much as possible. And if I can go to maybe an even more exciting slide, this is the combined pipeline for next year, where we have anticipated approvals, and that then adds up to 2 billion. So there is a substantial increase if we compare 23 to 24. You see on this list that there's a lot of things happening in Bangladesh, which is the country where most investments are going in 2024. I'm happy to see that a small island nation like Vanuatu is actually trying to support the skills delivery system, which is very important for that country. So colleagues, this was my attempt to give you a snapshot. And I know that this is not a deep dive. And maybe the key messages that I want you to take with you to the cocktails later on is that we need you as partners in this work. We need you in design, in implementation, in evaluation, and knowledge work. CMS is our platform, and Philip, this is your home turf, but that's the spot to be very familiar with. We do, sometimes I say, and maybe I shouldn't say it in this room, but I do it anyway, we over-design. We really want to have details. And you who have worked with us, you know that we are picky on the margins. So be careful, be on the dot when it comes to these types of works. And with that, I just would like to say thank you. And that is my email address. I'll take on a role where I hopefully can also guide you to relevant colleagues if you have specific questions in specific regions, in specific areas. So now I will not stand between you and the drinks anymore and say thank you.
After we've heard also from Vasantara, I would like to just shift gears and also hear about the health sector, and then I suggest we have a question and answer session afterwards. So Vasantara, if you're ready.
So the IT has to just change the slide. There's a bit of hiccup coming from different halls, so it's just a little bit of update if that's okay. How's everyone? It has been a long day, I hope, and hope this has been a productive day as well. Yes, so I'm representing colleagues from the health team, and this is from the health practice as well as the regional teams. So this has been pretty much on an overview of what we are doing as a health group, but I'll be happy to tour it and also direct you to different regions of your interest. So I'd like to start off with one of the new publications, which actually leading in different sections group. So the one that we have is called Health Sector Directional Guide 2030, and I think some of you might have already seen the full copy and also the summary outline. So that's our background. I just want to go through some of the key three themes area. So the first is key trends. These are where the health sector will be going up until 2030 and how we actually align with ADB strategy 2030. So we'll be looking at the changes, demographic shifts and urbanization. And by this, we don't just mean the aging population, but also reproductive health of the younger population as well. Climate change is one of the big area. Of course, we are a climate bank. And we'll go into that in a bit more details. So decentralization and regional cooperation is the area in which we are looking across sectors. And pandemic threats. So it's not just that we pass COVID-19, but also how we prepare the region for the next outbreak and how we can work together from this lesson learned. And lastly is digitalization, which is a new frontier, but also how we can actually work together within this. So across these trends, we come up with the 5 main operational focus. We look at the governance and policy public good, which is a higher level. We look at the health financing and incentive. And this is also to be able to bring both the private and public sector together and also reduce the out-of-pocket expenditure, especially for the country that hasn't achieved universal health coverage program. We also be looking at different aspects of health infrastructure, and this is where we can get a lot of help from different firms and also the consultancy services. Health sector, my colleague has already mentioned earlier, this is a very big issue, and for the word health for us is not only health professionals. It also means care workers and also alliance health, so this is a very big area. And lastly, as mentioned, pandemic preparedness and response. So I won't go through the guiding principle as this will be actually coming up throughout the presentation. I will mention just briefly about COVID-19. This is still ongoing work that ADB has been involved with since 2020. So we are now toward the end of the big project that we're working on, but at the same time, we want to highlight the impact, how this has on the health disruption of the health services, and also other areas such as well-being, and also in general, how it has in terms of economic impact overall and poverty and inequality. So the way we want to phrase is challenges that we have lingering impacts of the pandemic. So on the left side, we're still talking about how it has impact on health utilization. So we pretty much have 3 years that a number of services has to be stopped. We also talk about how it has impact on the community, how we bring the countries all together in the region. We, as ADB, also trying to put together the lesson learned on our operation during the last couple of years, and also how it has a long-term impact. This is still relatively new, it's only 3 years, so we don't know what's around the corner. So we want to make sure that the health systems is actually be prepared for what's coming up, and that could be in terms of preparing the vaccine manufacturing, and also different aspects of health insurance as well. So on the right-hand side, I just briefly mentioned the area that ADB has been working, all the way from emergency assistance, but also involved in the vaccine access facility to provide a timely access to the vaccine. In addition, one of the big aspects is a technical assistance, and this is in terms of preparing health workforce capacity buildings, and also mobilizing the community to actually be able to respond promptly. And the last thing that I mentioned is a vaccine advisory group, but also be able to strengthen the region to be able to produce the vaccine. And this could be a regular vaccine as well. It's not, doesn't have to be like infectious related vaccines such as a pandemic. This one I also want to mention that one of the sustainable development goals is on achieving universal health coverage. And the result still hasn't been equal. So some of the upper middle income countries' success has been quite more prominent, where in the middle and lower income countries, it still has been quite mixed in terms of the service coverage, but also a number of large countries still have a high household health expenditure, and you can see in the red zone, so a number of South Asia countries are still facing this issue up to 60% of the catastrophic health expenditure. The next area, which is I want to mention, is population aging, of course, and Asia is one of the regions that have a really high number. If you look at on the right-hand side, you can see that the projection for 2050 is quite striking, with some of the countries at over 30%. With people aged 60 or 65 in ADB, DMC country. What does it mean by having more elderly? With physical, of course, they have more chronic non-communicable diseases, and none of these conditions require long-term or more complex type of care and also follow-up. It also have an impact in the care workers, whether it's been not only health professionals, but the family care, which are heavily relied on, and what we'll be looking at in the next several decades. And of course, a gender aspect as well, because the primary caregivers are with women in the households. And that, as I mentioned already, the NCDs, and I want to mention in here that the NCD, at this stage, some of the country that hasn't achieved UHC, a number of those will be out-of-pocket expenditure, which actually can have a big impact on the country. So climate change and health. Climate change has been working on different aspects of ADB, but from our end, what we want to look at is the health sector, not only the impact on health sector, but health sector as one of the emitter of this issue. So we want to be part of the solution. And what we are looking at is to be able to look at the climate footprint and also to work with different organizations to be able to acknowledge how the projects that we're having can actually be able to acknowledge all these possible health implications of this climate's impact. So decarbonization is one aspect that the team is looking at with the pandemic preparedness and also with the health system resilience. So this year has been a number of climate change initiatives coming up with our health team, including the G20 and also the COP28 later part of the year. So the next one we want to mention is digital health innovation, and this is an area that the health sector team has been working in different aspects, from knowledge generation, but also different aspects of regional cooperation as well. So one of the things we also doing is on digital financing, so that's also be able to incorporate different aspects of digital technologies into the health sector. And also the latest work that we're doing is on mental health. That's also another area where we want to look at both NCDs and also mental health. So I'll just get into a bit of statistics here, and I found that it's quite interesting today. I learned quite a bit this morning as well about the ADB dashboard in the procurement, so we'll be able to do a bit of the number here. But what I want to mention here is that during pre-COVID, ADB health sector is relatively small, less than 5%, but of course in 2020 and 21, it has been gone up to 20, all the way to 30%. But even after pandemic, what we wanted to be able to achieve is that to still maintain a relatively large size of health sector portfolio and be able to expand across the area that we mentioned. And this is where we're hoping to be able to seek more collaboration with the private sector and also with the different, even with the university and a range of collaboration partners. Okay, this one is what I got early on. Just to mention about, I think similar to education, mention South Asia is a very big area for us. And in the next two slides, I will have a health sector pipeline project as well. So South Asia, Southeast Asia are quite large, but Central and Western region, Asian regions also quite coming up quite quickly as well in different aspects of health systems work. So yes, strongly recommend the dashboard, and it's quite responsive. I have checked it recently, so that's very good. And the other thing I want to mention is by nationality, which is also quite interesting to get an idea. So the dashboard have the recent one, which is here 18 to 22, but it's also have all the way down for the several decades as well. So it's quite interesting to see the trajectory of the nationality that has been involved. So this chart is involved all from consultings to services and work, but I think it's interesting to be able to look at the breakdown and how that changed and how that relevant to your sector. I mean, these are numbers from the health sector. So as I mentioned, these are some of the projects that we have in 2023 pipeline in different regions. So the amount is, as I have on the right side, just to give you a sense of the portfolio of each of the region. So these are the combination of loan, different type of loan, sovereign loan, and we haven't had, what we don't have in here is regional technical assistance work, which is actually across a number of the countries. So this is South Asia and Southeast Asia. South Asia has quite a large portfolio, especially in Bangladesh, and also leading on to the new one in 2024 onwards as well. So now I just want to come back again and highlight some of the area that we discussed before. So these are the area that, of course, these are not the only thing we're working with, but these are actually linked quite well with our pipeline project and what we see ourselves going next, especially towards 2030. The one that I haven't mentioned is medical education, and this is actually quite important that we also trying to upgrade nursing school, for example, in South Asia. So with summary of the outlook, I think we already mentioned briefly about how we really aim to increase the spending on health, and this would actually make the portfolio much bigger. We also start looking on multi-sectoral work, not only with education and social protection, but we're looking at with linked with transport, for example, because transport is such a big area at the ADB, but post-trauma care, for example, is quite important to be able to take into account how the development in road and actually balance that with the health or emergency response impact. We also be looking at innovative financing through private sector, and as I mentioned about digital technology as well, develop human resources and skills, and demand for knowledge products. I think this is one of the areas. I came from academics, so initially ADB is not a place where I'll be looking for technical input, but I think this is the area where we can work with the university, with different institutes, and we can actually bring the partnership on how we can bring your knowledge to actually the operation that we are doing. So that linked to my last point about consulting business opportunity. This is one of the area. We're also looking at, I'm actually following the line that Per mentioned, a different aspect all the way from inception at the very beginning in terms of how we plan the project, but also in innovative monitoring and evaluation. I think that's something that we very much welcome. And of course, cross-sectoral expertise, because sometimes, even though we deal with Minister of Health, but it's not always just that. It's always Minister of Social Welfare, Education, different aspects. So we want to acknowledge that. And of course, as I mentioned, the knowledge products. So that's it from myself. But as I mentioned, I'm actually represent the team as a focal point here. I think half of the team are traveling, but we're very much welcome to be able to link you to whether it's regions or whether it's thematic point. And thank you very much for coming.
Thank you very much, Vasantara. So let me just see. Yes, we have plenty of time to take a few questions. Please raise your hand, and when I call on you, I'd appreciate if you could give us your name, your company affiliation, and country, and perhaps if your question is aimed at one of our speakers specifically. So, the gentleman in the back, and I'll get to you next. Yes, if you could come to the center to the microphone, please. Is it working?
I can be loud enough.
If someone from IT could just, in the meantime, come and look at the microphone. I can hear you, even without the microphone. But yeah.
Thanks a lot for great presentations and the insights. Very intriguing, actually. So what I wanted to know, I'm from iTech Mission, based out of New Delhi in India. We are Tech for Good organization. So how do we reach out to you if we have innovative solutions in both health and education? Because of course we see tender opportunities. But what about some solutions that we have which are innovative? How do we reach out and, so that we could have a brown bag kind of thing? So that's my question to you guys.
Should I take a couple of questions, or you want to respond? I'll just take a couple of questions, and we'll pass it on to our panelists. I think you were next, yes, and I'll get to you.
Yeah. I am Anish from IDCG Delhi, India. I saw in the presentation on the education one that there are certain projects which you have labeled as project for results, where the payments is result-based projects. So out of the total portfolio or the pipeline for almost 2 billion, what percentage of that would be such loans which are project for results?
Thank you. Yes.
Hello, thank you for the presentations. My name is Camille Khoury. I work for Colleges and Institutes Canada. We are in workforce development in Canada, of course, but around the world, in Africa, Latin America, Caribbean, and of course here in Asia. I had a quick question of clarification for Vasuntara, you mentioned innovative finance in the health sector. I wondered if you could give a little bit more details on what is meant by that. It's also an area of emerging interest for us, and we're developing a few things, so I'd be interested to know if there's any match there. Thank you very much.
Thank you. Maybe we'll take this batch of questions, and maybe I don't know if I can ask Vasuntara to take the last question first, and then I leave it up to you if you both want to respond to the others, because they were not sector specific. Yes.
So digital financing is, as I mentioned, quite relatively new area for us. But one of the areas that we're looking at is to be able to use the different aspects of digital money to also reach out to the different aspects of insurance as well. So I think this is where it's still at very much in the inception stage, where we wanted to be able to see what we can strengthen the country. So we have already received some requests from developing member countries that they want to be able to expand these aspects, but we want to see what we can do. So the three part we did, as I mentioned, that using the digital for the health insurance. The second one is the e-money side. And also the third one, I think this is where they wanted to have sort of innovation challenge to see what are existing technology out there that we can be applicable not only to developed countries, but also developing countries. And this fit in under one of the third area I mentioned, I'll be able to connect you with the team. Maybe I can touch upon the first question a little bit. So this is where we welcome the firm ideas also as part of Innovation Challenge, and this has also been announced in the ADB platform. So this is where we hear your idea, what you can do, and whether it can actually align with the demand from the countries. Thank you.
Thanks, Vasuntara. Per, do you want to?
Yeah, maybe just to add on that, we are always interested in ideas and knowledge. Then I think it's important to kind of understand that we are a bank, and at the end of the day, it's the clients that are the main driver of what are the future solutions. We should bring good ideas to the table. We should jointly try to design what's best for the country, do good analytical work. But I sometimes sense that organizations come thinking that we are a donor that could just fund an intervention somewhere out of the blue. That never happens. There is a client at the end of the day who has a need that we should address. But having that said, please, we welcome all ideas, all contacts, just reach out. The specific question of result-based lending, that is a substantial part of the education portfolio, and I do think it's a substantial part of the health portfolio as well. I am not in a position to give the exact numbers now, but would be happy to find out about that when it comes to the pipeline, and maybe we could communicate that in some way and form after this forum.
Yes. Any other questions? The gentleman here.
Hi, my name is Claudio Meirovich. I'm from Meirovich Consulting from Spain. I think this question is probably for Philip, because there have been talking in the previous session about the possibility to have framework contracts and for other sectors, and I'm not sure if in the health and education sector we are actually a consulting company for health. If there is an idea to do such a thing, or to have any kind of LTAs or framework agreements, that's basically a question.
Yeah, I can indeed perhaps answer that one. And so the decision of whether to have a framework agreement in place is of course driven by the pipeline, right? So depending on the pipeline we see, and whether in this pipeline we see recurrent needs for similar technical expertise or for similar consultancy expertise, then it makes sense. For the time being, to the best of my knowledge, the needs we had from existing projects were not similar enough to warrant a larger framework contract, right? Unless you start breaking it down into much, much smaller subcategories, but then you miss, you lose kind of the intention of the framework agreement, which is to cover a broad range of needs. And so I think it's there. We're going to use it certainly if we see, and we monitor the pipeline constantly, if we see in the pipeline a recurring need that is similar enough that would warrant a framework agreement, we will certainly apply that tool. It's something that we like to do. We just need to have the right conditions to do it. Yes, please.
Thank you. Brendan Allen from Burnett Institute in Australia. We're a public health and medical research institute. I'm probably interested in the internal advocacy within ADB for cross-sectoral inputs. And I'm thinking One Health activities that align with agriculture and environment, perhaps menstrual hygiene with the wash sector. So I'm wondering how we can engage across the different departments that may not recognise or identify those inputs that could be necessary. Thank you.
That's great. I think we heard this morning, there was a panel, and I think the senior directors from the various sector groups already mentioned that they're increasingly looking at multisectorial solutions to multisectorial problems, right? And that is happening at that level. But I don't know if either of you can, at the more technical operational level, has a response on how that would happen.
I don't have an answer, but maybe just a reflection that clearly this is becoming more and more critical. And these types of projects, they do happen. I just have a recent example in Mongolia where there is an urban development project which is very closely linked to a skills development project as one of those aspects, which started out as a flood protection, water supply project, but it was clear that skills development is a critical part of this. So it has happened, but the whole reorganization of ADB really encourages that type of thinking. So I think you are spot on what also the bank tries to achieve. We are not there yet, and we don't have all the tools in place for those solutions, but we are heading in that direction. There's no doubt.
Similarly as well, yes, there's a trend, I think, in Gunsten, especially after norm, and I think that's one of the reasons why there's this change coming up within the organization. So a couple examples I can give with more recent multi-sector is transport and health, that's one. There's also tourism and health, which is after the COVID, that's how to bring that come about. And the third one is One Health, as you mentioned. And this is also not only the agriculture and health, but also the border control and how we can actually work together to be able to address that. So we are just getting into that. Thank you.
Thank you. Any other pending questions? Yes, please.
Good afternoon, everyone. Thank you so much for such an enlightening presentation. I'm Shobhit Mathur from Ernst & Young. I have a question that as ADB, especially in the health and education sector, are you looking at funding or giving loans and assistance to governments to develop digital public goods? DPGs, as we understand, have really transformed the way the movement toward SDGs is happening globally. And within the G20 declaration as well, there was a very prominent mention of how DPGs should be leveraged. Just wanted to know ADB's position on that. Thank you.
Thank you.
I couldn't comment too much on it, but I can say that even within our health team, we also want to learn more across with other teams. So we also have a digital team within the ADB. So that's where we also wanted to be able to collaborate. Because as I mentioned, sometimes within sector specific, we are still very much have a only limited range of what we can do, but certainly the DPG would be something that would be quite useful.
I'm thinking from the education space, of course, the whole area of digital teaching and learning material, the whole way of delivering education. And we have a number of examples where also regions, sometimes with small member countries, they come together to really create public goods and tools that could benefit students, teachers, learners, employers in a wider context. And here's our kind of regional technical assistance becomes important, I think, especially for regions with smaller countries, because it doesn't make sense for small countries to always develop this by themselves. So there are a number of examples, I would say, that is already ongoing, and it's an agenda that is being pushed.
Thank you. Yes, I don't see any frantic hand signs yet that I need to close, so please, I can take one or two more questions.
Thank you. Being the last, will not be holding anybody longer. Both for education and health sector, innovative monitoring and evaluation was a concept. So can we have a little elaboration on what exactly is innovation in M&E? And plus, we now focusing more on results-based lending. So is bank considering having the M&E part with itself rather than the implementing partner? So have more control over how the lending funds are being utilized?
I don't have a good definition of innovating evaluation. I think we increasingly are looking at impact, that we want to see results. Our clients and our management are not happy with looking at activities or outputs. How do we change people's lives? Are these investments beneficial for the target group that we are aiming for? So finding ways to make that happen is what we are looking for. And I don't think there is a definition. I think this needs to be applied for the context and the project and the intervention, but it's an area where we need to shape up.
Thank you.
And probably there was a second part to it. With results-based lending, would it be better to have that control with the bank directly?
Sorry, I can't comment on the second one, but maybe just go back to the first one just a little bit only. Sorry. So sorry, I just want to mention a bit about that innovation. As Per mentioned, it's probably have to be quite context specific. ADB, of course, have a guideline what we reported to the board and the developing member countries. But also when we introduce something different, like telemedicine, for example, it might not be a benchmark already there. So we wanted to be able to accommodate that as well. And COVID-19 was one of that example where we have to find different benchmarks. Sorry, that's probably what I mean by innovation. Sorry, I can't ask.
I think the whole topic of results-based lending and how big that is and how that is really being applied, I think that is something we need to come back to, because I don't have the specialist knowledge in that, I must admit.
Yes, I think that spans across all sectors. So I think it's not a question that's specifically for this session, but I'm sure that we can we can find you the right contact to have that conversation.
Thank you.
And I saw one more hand back there.
Hi, good afternoon. I'd just like to ask, in the sector of education, I saw about blockchain. Can you explain on us what are the opportunities of working with ADB with regards with blockchain? Thank you.
I think that at the end of the day, this comes from client needs. And I think especially in the area of higher education and when it comes to credentials, when it comes to various types of certification, this is an area where we are getting questions. At this point in time, we don't have any concrete projects working on this, but it's clearly an emerging area in the education space where we will see more work in the future, and it's coming already now in the pipeline. So So my personal opinion is that that's the space where blockchain can be used, and it's being used in many areas, and now our DMCs are picking up on that.
Okay, so I want to thank the panel for tackling these challenging but very interesting questions. And thank you all for hanging in there until this time of the day. You are hereby free to go and join the cocktails. And we look forward to seeing you at the cocktails and, of course, throughout the day tomorrow. Thank you very much.